Welcome back. This segment is sponsored by iChiro, Peak Performance Chiropractic. Now, we all like to put things off. I'm guilty of it as well. But when it comes to your health, it is important to be proactive. Dr. Mike Kwast is here to explain the last straw on the camel's back phenomenon and some ways to avoid it. I feel like our whole group of friends all kind of do this. We sort of wait to the very last minute. What is your theory on the last straw before the camel's back?
Well, it's kind of interesting. A lot of people will come in a crisis.
Yes,
you know,
when all things are falling apart.
Yeah, and 90% of the time we say, what did you do? And they say, nothing. And I go, what do you mean you didn't? Nothing. You know what I mean? They can't walk, or they can't turn their head, or they have a horrible headache, and it just came on, and now they have to seek crisis care intervention. When what we find, you know, typically what you'll see is the day before that person had the crisis, you could have identified that that crisis was coming, just not by pain.
Okay.
So, for example, some of the testing that we do, like range of motion, how far you can bend and move, but things even like muscle knots. So, for example, if you had 20 muscle knots in your lower back, but feel great, and then your exact clone has 3 muscle knots and feels great, which one's going to get hurt tomorrow when they bend down to tie their shoe?
I'm going to go with 20.
Yeah. So
yes.
What you see is there are indicators that you can see where a person's going to have a problem before they have the problem. And then what you do is you watch the testing instead of your pain, and then you don't get the pain.
So you can kind of jump on things before they happen a little bit.
Yeah, I discovered this when I was a kid. I had horrible migraines. Nobody knew what to do. I was on all these different drugs. Nothing worked. And we finally started going to a chiropractor, and that helped me tremendously. But he would say to me, he would say, come back when you get another headache. And I remember thinking, that's dumb. I don't ever want to get another headache.
I'd rather come back before and prevent the headache that goes in there.
Tell me what to do so I don't get them, because that would ruin my life for that day.
Oh, yeah.
And so it's actually smarter and better to be on the front end of those things to try to prevent the problem from happening, and then you don't have crises, which is like, who doesn't want that?
So what do you recommend then? Do you recommend that people just come in and touch base like a period of time, like once a month, or come in just for an initial, you know, and you can identify some things that might be going on with their body?
Yeah, the first step is always to do an evaluation to just see what they have going on. You know, see if you've got 40 muscle knots and you can't move or bend, you know, because then you're susceptible. And somebody who doesn't have those things is not susceptible. And those two scenarios would require completely different treatment plans as far as what we would recommend or what's going on. But the key is to be able to watch testing instead of just how you feel. And really that's no different than in dentistry. I mean, if you only run to the dentist, if you waited till your teeth hurt so bad that you couldn't chew and then you went to the dentist, I mean, it's going to be horrific. Or if you only get a mammogram when you feel bad, or you only get your blood pressure tested when you're feeling it. I mean, none of that works. So to think that that works with other things is just kind of not even making sense.
What is the testing that you normally do?
Well, the muscle knots, range of motion, how far you can bend them, or orthopedic testing.
Are we talking like whole body, like knees and ankles?
Yeah, you check everything out. Because a lot of times you'll actually find things going on with people, especially with hips and knees.
Oh, yeah.
We'll often see problems where they are not functioning well, even though they don't hurt yet. And then what people tend to do is when it does start to hurt, they just take masking medicines.
Yeah, like ibuprofen, a lot of it.
Yeah, and painkillers, sometimes even addictive things. And then it just gets worse and worse and worse, and then, oh, gee, your hip wore out. And it's like, well, yeah, we knew that was going to happen, you know, years before from the testing that we did that showed us you have problems coming. Wouldn't you rather do something about it now than wait until you have to have, and then have a really drastic thing you have to do to try to get help?
All right, some very good tips in there. So if you are interested, call iChiro Peak Performance Chiropractic to schedule an evaluation and get tested. Mention that you saw them here on Take 5 and get a free 25-minute massage coupon as well. We've also put all of this information on our website, WZZM13.com. Just click